Good morning. This is Dr. Walker. Welcome back to the channel, Denwalker.com. Today I want to talk a little about a discussion I've been hearing a lot about in the last couple of months, pericardial effusion. So pericardial effusion is essentially excessive fluid around the heart, heart in a sac called the pericardial sac. So typically, when you look at the pericardial sac on imaging, there is essentially no fluid in there, right? But there's a little bit of fluid, about 3 tablespoons or so of fluid in there. And the intent of that is just to reduce the friction of the heart itself when the heart essentially beats. Now, 10 years ago, 5 years ago even, if someone were to ask you what is the most common cause of a pericardial effusion, it would be viral or bacterial infection. Typically, it's Coxsackie. It's a weird bug. But that was the main focus or main cause of this effusion that I'm talking about. In the last year or so, I'll go one step behind. So before, let's say 3 years ago, the amount of time that I've seen a pericardial effusion was probably at most between 5 and 10 times in the last 20 years, at most, which means that I have visible fluid. And again, in the sac is pericardial sac is what it's termed, and it's a thin layer of fibrous tissue that holds just a little bit of fluid, as I said before, a little bit of fluid in there, just again to reduce the friction of the heart. So you typically don't see it on any of the images that you do, MRI, CT. You don't typically see fluid in the sac. And again, it's just a little bit of fluid, just for friction reduction and those kind of things. So when you do see it, it's important to notice. It's important to suggest. It's important to figure out exactly what that's from. But again, before 3 years ago, you almost never saw it. In the last few years, however, I see it now probably daily, if not multiple times a day. Now, the concern now is what's the source, what's the cause of the fluid? What is the source? Now, if you have figured it out, or you know what's the cause of it, it's a treatable process in that you either give them antiviral or antibacterial and you take care of it. The problem now is that I don't know what the cause of it is now. I don't think it's a viral or bacterial process because, again, the amount of people I see with it now is significantly different than even 3 years ago. Significantly different in terms of, number one, in terms of the amount of people that I see with the fluid, and the amount of fluid, significant. And I mention it for this main reason. Pericardial effusion can develop and can grow slowly. And when it grows slowly, it's not that much of a concern, and sometimes it'll stop and regress in and of itself. So usually, you may see it, if you do see it, it'll be there for maybe weeks to months. Some people have it for years, but usually it's a slow-growing process. When it happens slowly, the fibrous capsule around the heart, the pericardium again, is able to stretch and accommodate the fluid collection. However, if the fluid collection grows too quickly around the heart, then you worry about a process called tamponade. So a tamponade essentially is that the heart is not able to relax to get blood into it, and obviously then squeeze the blood out. So in other words, if you can't oxygenate the body, i.e. you can't get blood in and out of the heart, then that's not compatible with life. It's not compatible with life. So it depends on how quickly this thing develops. So I mention it to say that if you have things like new shortness of breath, especially after vaccination, and again, which vaccine, I'm not saying which, but okay, shortness of breath, post vaccination, or chest pain. Chest pain, some would say, if you, it's usually seen in people who are, if they're taking a big breath, for example, the chest pressure, pain, and shortness of breath, it gets worse. If they lean forward and take a big breath in, that sort of stuff, those people get worse because that fluid, again, is restricting the heart from actually expanding and then contracting, obviously, so then you can't get blood to the rest of the body. That's the problem with the pericardial effusion, and that's sort of one of the main way it presents, right? If you're taking a big breath, the pressure or the shortness of breath or chest pain increases. If you lean forward, taking a big breath, sort of the same thing, pressure increases, chest pain increases. Those conditions, or you have this chronic dull chest pressure or pain. And again, people, younger people less than 40 typically should not and do not have this condition, unless there is again some other autoimmune process. They have some underlying cancer, malignancy, they have an underlying bacterial viral infection. They typically do not get pericardial effusion, and then the concern would not be about pericardial tamponade or tamponade in and of itself, because again, they typically do not have these conditions. But a younger person leans forward, shortness of breath, chest pain, chest pressure, post-vaccination, should be concerned, and concerned from the standpoint of being evaluated by your physician to say, hey, I have a concern about this thing. And again, it's happening more and more. And if I'm seeing it as much as I'm seeing it, then I'm assuming other people are seeing it at their level just as well. One way to determine that, they can listen to your heart with a stethoscope and help to determine whether or not you have sort of a heart sound or changes that is suggestive of pericardial effusion. Or you can do imaging. Chest X-ray sometimes will see if there is a sort of a water bottle shaped heart, in that you have a heart that's bigger than normal. That would be another way of seeing it. Or you can do an ultrasound as well. An ultrasound can actually see exactly how much fluid you have, and can actually quantify how much fluid you have around the heart, and determine if you have restriction secondary to the fluid around the heart, and look at the functionality of the heart. Has it been depressed or has it been decreased? Things like that. So that's it. So again, the discussions about pericardial effusion and tamponade, excessive fluid around the heart, which again is not something you typically see, but something I'm seeing more and more. And just again, if you have some symptoms that I mentioned before, shortness of breath, chest pain, dull chest pain, positional chest pain, positional shortness of breath, then see a doctor about getting an evaluation to determine or to exclude pericardial tamponade or pericardial effusion. Thanks, Dr. Walker.